So I'm at work with nothing to do right now, so I figured I'd make this video to talk about some of the pros about having gastric surgery. I'm going to talk about my reasons, and then I'm also going to talk about some reasons that don't really apply to me, but they're pros that I found out from friends and family members that's had gastric surgery, and then also a few extras that my doctor talked about along the way. So starting out, obviously, the main goal for having having bariatric surgery is for weight loss. That's usually why we're seeking a bariatric doctor to talk to them about options and to figure out what is the best fit for weight loss. So I'm going to skip over that one because we all know that is the main pro for bariatric surgery. So the second pro for me was my doctor explained that if I had issues with heartburn, indigestion, or acid reflux, after surgery you don't experience those issues anymore, which was a huge deal for me because I had heartburn and acid reflux problems to the point that I couldn't even drink regular water without having heartburn afterwards. I don't know if if it has to do with the purification process or what, because I talked to my doctor about it and he said that wasn't normal, that people don't experience that problem, so he wouldn't know where to begin. So I guess I'm just an abnormal. But since surgery, obviously afterwards they push hydration, and the best way to do so is by drinking water. So since then, I had experienced just a slight bit of heartburn after surgery, but now I don't experience that at all. I can drink as much water as I want, which is fantastic because I drink water daily now. So that was a huge pro for me. The second pro is that diabetes runs pretty heavily throughout my family, so I was fearful of becoming diabetic, and having surgery would help to prevent that. I was right on the border of becoming pre-diabetic before surgery. I have not had current labs, but I'm pretty sure probably my A1C and everything has come down since then, especially with not eating as much sugary stuff or anything sweet. Now everything is extremely sweet. It's crazy. So then another reason why I decided to have gastric sleeve surgery is because obviously weight is a huge factor that we already talked about, and I have a previous knee injury that is affected by my weight, obviously. So being able to take that weight off my knee also was a huge pro, because now I can walk and stand and do everything that I need to strengthen my knee back. So that was obviously a reason on my list of why to have gastric sleeve surgery. So the final reason why, and I'm not going to really talk too much detail about it because it's not something that you just walk up to people and talk about or tell people on the internet about, but I have complication with female issues, and having gastric sleeve surgery would also help to correct those, or alleviate those problems. So that was another reason why I decided that having gastric surgery was an option for me, because it would help to put everything back into alignment with female things. So some other reasons that I know of that people have talked about for having gastric sleeve surgery, one is hypertension and high blood pressure. So if you have high blood pressure, a lot of times you come off those blood pressure medicines pretty quickly, as you drop weight. Another reason why I know that people have had, or it has been a pro for them to have gastric surgery, is because of sleep apnea. I know some friends that even just after dropping some weight, they came off their sleep apnea machines. And then also I know it reduces I think cardiac disease or something like that, and then reduces oh gosh, what was the other one? I'm blanking. But I mean, obviously, not all of these reasons could be good reasons for you to have gastric sleeve surgery, but obviously, talking to a doctor is the best thing to do. But I know there are a lot of pros to having gastric sleeve surgery or gastric bypass surgery. So I guess the best thing to do is to do some research for, what helps you and what are better options for you. I mean, obviously, there's different avenues for gastric surgery. There's the lap band, there's the gastric sleeve, there's the full bypass. There are balloons, I think, that you can swallow. It's the size of a pill. So, I mean, obviously, there's a lot more options out there than just having gastric surgery. But I figured I would share some of my pros for why I decided to have gastric surgery. And obviously, your health may be different than mine, and what helps me isn't going to help you. So definitely do your research before having any kind of procedure done. But I hope this helps. If you have any questions, feel free to ask. I will do my best to answer any questions that come up, and I will talk to you again.